It's the most wonderful time of the year, the holidays, the winter is here. Karlo on the road to recovery, presented by Hoag Orthopedic Institute. Dr. Beyer, I think we can call it the maybe snowy, colder road to recovery because it's time for winter sports.
Yes, winter sports are definitely upon us. The temperature is telling us that. We're starting to see the snowfall and the higher elevation, so it's definitely here.
It's time for those athletes who love to get their skis out, get their snowboards out, maybe even their ice skates out of the closet and get going. I mean, surprisingly, especially here in California, we got a lot of snow the last couple of months. I was hearing about some record snowfall in some parts of the mountains. Now it's a little different with the Santa Ana winds and some of the temperatures being in the 70s. But this is the time of the year that some of these athletes are the most active.
Well, I kind of chuckle at you keep calling them athletes and I keep calling them weekend warriors. And that's kind of like a big difference. Everybody thinks when they pack up the skis and pack up their equipment and pile into the car, they're going to show their athletic prowess. But unfortunately, when you go to an activity that you haven't been doing for the last 9 or 10 months, you're not always the most athletic at it. So I think the most important part of this is the pre-trip preparation. And that involves kind of two things. It involves conditioning, getting yourself stronger so you can make those runs, especially the afternoon runs when your muscles are a little bit more tired and pooped out from your day's activities. And you're at altitude, which increases your susceptibility to pooping out a little bit faster as well. And also check your equipment. Your equipment's been stowed in the garage or in your closet for the last 8 months. And the most common thing I always hear from skiers or snowboarders who come in with an injury is my bindings didn't release. Well, you know what? The time to check that isn't while you're on the lift or while you're shushing down on your first run. The time to check that is before you leave. So make sure your equipment's in top shape. Everything's clean, everything's lubricated, everything's working properly. And that's going to ensure a more likely positive outcome for you on the trip. I think also packing the appropriate clothes to wear, layering up, as you alluded to. It's still a little warm compared to what we get in the dead of winter. So you want to use layers. So that way you can peel off the layers if it's a little bit warmer or add another layer as the sun goes down and gets a little bit cooler. So the preparation has to be preparing your body, preparing your equipment, and preparing the clothes that you're going to wear. So you ensure the highest, lack of risk of something untoward happening.
Doc, like you like to call them, the weekend warriors, what are some exercises or some little workouts that can help with that conditioning that you mentioned?
Well, before the trip starts, I think, especially for skiing and snowboarding, getting your quads, hamstrings, lower extremity musculature, your big power muscles of your lower extremity stronger is very important. So that can be in the form of some cardio type stuff on a Peloton or on an elliptical to build up the endurance, and some strengthening on machines or using weights to get the quads and hams stronger. Assuming one has accomplished that and you're now on the trip, you can't just leave the lodge, get dressed, and go right up to the top of the mountain, especially those of us who are in the latter half of our existence. You got to stretch a little bit, just like you have to stretch for anything. So you want to stretch your lowers, you want to stretch your upper body, your shoulders, your neck a little bit, because these are working hard when you're using those ski poles or even when you're snowboarding just for balance. So a quick little stretch, a couple of minutes spent on a quick little stretch while you're downing that last hot chocolate is probably a good thing to do. I think that the preparation is the key, so you're able to enjoy it more, able to spend more time on the slopes. But even when you're up there, you just want to stretch before you start.
And one of those other injuries that even I've kind of experienced while snowboarding. I remember taking a hard fall, falling on my bum, and kind of hitting my head and seeing the next thing I knew was seeing my helmet roll down the hill. Now, I want to talk about possible head injuries. Like, how can you prepare yourself for maybe taking some sort of contact with the ground, possible concussion?
Well, certainly the use of helmets is obviously the first step. whether you're skiing or snowboarding. You've got to protect your head. I think you've got to stay on trails. When you go off trail, trees become a big factor, rocks become a big factor. I don't have to name certain celebrities who were killed skiing because they didn't follow these obvious instructions. Um, and the other thing that's really, really important that I don't think we talk enough about is keeping your head on a swivel. You might be really serious about it and follow all the safety rules and do everything else, but you're not responsible for what everybody else on that mountain is doing. And just like there's a lot of crazy people out there driving cars haphazardly and not following the rules of the road, there are a lot of people on the mountain who are not following the rules of the road and are just a little bit foolhardy, maybe out in front of their skis is the perfect term here, right? Maybe taking on something that they're not quite ready to do, and they get themselves in trouble, and they're just as much a danger to you as you are to yourself. So keep your head on a swivel and really kind of know what's around you and try to keep track of what's coming and what's ahead of you to try to minimize the risk of hitting another skier or another skier hitting you.
Another injury that I want to bring up that only comes up at this time of the year is skier's thumb. How often are you seeing skier's thumb with your
Skiers
patients?
skier's thumb is actually what we used to call in the old days a gamekeeper's thumb, because the gamekeepers in merry old England used to break the necks of squirrels and other small rodents, and they applied that same force to the thumb, to the collateral ligament of the thumb, and it would tear, and that therefore it was called a gamekeeper's thumb. Then it became skier's thumb. Now I like to call it Mike Trout thumb because it's also the same exact injury that Mike Trout had, sliding headfirst into second base, caught the base with his thumb and tore those ligaments and had to have surgery to fix that. And now wears an oven mitt while he's running the bases, as many other players are doing as well. So it occurs because the cord that's attached to the end of the pole, many skiers will wrap that around their thumb. So if the pole stays stuck in the ground, it pulls their thumb in exactly that same direction as if they slid into second base and hit the side of the base with their thumb. Um, Rule of thumb, no pun intended, is don't wrap the little rope that's on the end of the ski pole around your thumb. Put it on the wrist or put it across all four fingers so all four fingers are holding it, but don't wrap it around just your thumb because if that pole gets stuck and you keep going, you're going to tear your collateral ligament of the thumb.
You earlier mentioned taking a sip of your hot chocolate. That kind of stuck to me because not all winter athletes are up there with a cup of hot chocolate. Maybe it's a cup of whiskey. Maybe it's I personally think that they should be staying hydrated with water, which is something to keep in mind when you're colder and maybe not thinking of feeling so parched. But what about the importance of maybe not drinking alcohol?
Well, it's really kind of obvious. First of all, your point about hydration is a very, very good one. This is an athletic activity like anything else. Your body needs to be replenished of the fluids that it loses, especially when you're sweating under some heavy ski gear that you're wearing and the sun might be out, cause you sweat a little bit more. There's even more reasons not to drink alcohol while you're skiing than there is not to drink alcohol while you're driving. First of all, your concentration is somewhat impaired. Okay, that goes without saying with any kind of alcoholic beverage. Number one. Number two, you're in cold weather usually. Alcohol is a vasodilator. It opens up your blood vessels. You know how your cheeks and your nose get a little bit red when you've had a cocktail or two too many? If that happens while you're out there on the ski slopes, your body temperature is going to go down because your body's throwing off all this heat because you've been vasodilated from the alcohol, and you're in a cold climate, often at altitude, which by the way makes the alcohol go to your head even a little bit faster because your oxygen levels are a little bit lower. And it's just a cocktail that doesn't work. I think wait till after your last run of the day. And if that happens to be at lunchtime, when you had a glass of wine or two with your lunch, fine, take the bus down and enjoy yourself and be safe. I think that, it's funny how we use the term last run of the day. I love when a patient comes into the office and says, I was hurt on my last run of the day. Of course it was your last run of the day. You blew out your knee. You couldn't ski anymore. So that's why it was your last run of the day, not because it was 5 o'clock at night. So I think that The alcohol should wait till evening when you're getting back together with your friends and reliving the highlights of what you experienced that day. And don't take advantage of that while you're still out there skiing, putting yourself and others at risk.
Dr. B, you definitely reminded me of some stories of some friends who said, man, I said it was going to be my last run. And of course, their last run was their worst one because they ended up getting hurt. But yeah, I'm glad it's not an uncommon occurrence. It's sad.
You
Dr.
know,
B,
statistically, Carlos, sorry to cut you off, we do see more injuries on the late afternoon runs, but that's a function of fatigue. The skiers gotten somewhat fatigued. Your muscles aren't as quick to react to something that happens, and that's why injuries occur more frequently towards the latter part of the day when people have lost some of their endurance.
and like you've talked before, some these skiers and snowboarders want to get a bang for their buck and make the most out of their pass. And they've been going all day and they hit a point in the afternoon and where their body can't take it anymore.
Your copay or your deductible for your significant injury is going to be far higher than what that ski pass cost. So keep that in mind and don't try to get every single ounce of credit out of it.
If I'm going to take away anything from this Road to Recovery episode, I'm going to take away that. Thanks a lot, Dr. Beyer, for joining us on a Road to Recovery focused on winter sports. Dr. B, what's coming up on the Doc in the Dugout?
Thank you so much for having me. As always, we still have the Doctor in the Dugout every Saturday at 12 noon on Angels Radio AM 830. This week, my special guest is going to be one of our HOI Sports Medicine Fellows, Dr. Saunders, just to tell us about his journey, how he got into sports medicine, what's involved in a sports medicine fellowship, and what research projects he's working on. So it should be quite interesting.
Thanks a lot, Dr. Beyer, for joining us on the Road to Recovery presented by Hoag Orthopedic Institute.
Thank you, Karlo, and enjoy the holidays.